Well, hey, everybody, this is Robert, and welcome to today's show. And the big news that came upon us Friday afternoon was the CDC and Texas state health authorities confirmed a case of monkeypox in a traveler who went to Nigeria and returned from Nigeria. And this is the CDC press release. And it says the CDC and the Texas Department of Health confirmed on July 15th a case of human monkeypox in a U.S. resident who recently traveled from Nigeria to the U.S. The person is currently hospitalized in Dallas. The CDC is working with the airline and state and local health officials to contact airline passengers and others who may have been in contact with the patient during two flights. A Lagos, Nigeria to Atlanta flight on July 8th with arrival on July 9th, and an Atlanta to Dallas flight on July 9th. Travelers on these flights were required to wear a mask as well as in U.S. airports due to the ongoing COVID pandemic. Therefore, it's believed that the risk of spread of monkeypox via respiratory droplets to others on the planes and in the airports is low. So they're working with the airlines also. And of course, this is not the first time that monkeypox has left the African continent and found its way to another country. We recently saw some cases in the UK and Wales. A couple years ago, we saw a case in Israel and one in Singapore. So this is not unheard of. Okay, let's go to see what the Texas Department of Health had to say. They're working with Dallas County to investigate the single case of monkeypox. We see that it is a Dallas County resident who recently returned from Nigeria. The patient is isolated in the hospital. They've identified a few people who may have been exposed in Dallas and are monitoring them for symptoms. And then the Dallas County Health Department, pretty much all the same information, but they had a couple quotes, and quote, "While rare, this case is not a reason for alarm, and we do not expect any threat to the general public. Dallas County Health and Human Services is working closely with local providers as well as our state and federal partners." And that was from Dallas County Judge Clay Jenkins. And Dallas County Health Department Director Dr. Philip Wang said, "We have been working closely with the CDC and Texas Department of Health and have conducted interviews with the patient and close contacts that were exposed. We have determined that there is very little risk to the general public. This is another demonstration of the importance of maintaining a strong public health infrastructure, as we are only a plane ride away from any global infectious disease." Yeah, and isn't that true? And let's go back about 7 years, and it was Dallas then too when we had the first Ebola case arrive in this country. And Thomas Eric Duncan, you may remember his name. He was treated at the Texas Health Presbyterian Hospital in Dallas, and he did eventually die after several weeks. And if you remember correctly, there was a couple of nurses that cared for him that also contracted Ebola. And they were the first ones to contract Ebola on United States soil. Now, has monkeypox ever been in the U.S. before? Well, yeah. In 2003, there was an outbreak of monkeypox in this country, and it was the first time monkeypox was ever reported outside of Africa. And there were 47 confirmed and probable cases from 6 states: Illinois, Indiana, Kansas, Missouri, Ohio, and Wisconsin during this outbreak 18 years ago. And according to the investigation back then, they determined that a shipment of animals from Ghana imported to Texas on April 9th, 2003, introduced monkeypox from the West African genetic group, or the clade, into the United States. And there was a bunch of animals that included rope squirrels, tree squirrels, African giant pouch rats, brush-tailed porcupines, dormice, and striped mice. Laboratory testing using PCR and virus isolation demonstrated that 2 African giant pouch rats, 9 dormice, and 3 rope squirrels were infected with monkeypox. In addition, after the importation to the U.S., some of the infected animals were housed in close proximity to prairie dogs at the facilities of an Illinois animal vendor. And these prairie dogs were also sold as pets prior to their developing signs of infection. All the people with monkeypox became ill after having contact with the infected prairie dogs that were purchased as pets. There were no instances of monkeypox attributed exclusively to person-to-person contact. So that was a big story back in 2003. For those of you old enough to remember, so that was the first case of monkeypox outside of the African continent. And let me go ahead and close out with a little information about monkeypox. This is from the World Health Organization. Monkeypox is a sylvatic zoonosis with incidental human infections that occur sporadically in forested parts of Central and West Africa. It's caused by the monkeypox virus. This belongs to the orthopox virus family, like smallpox. It's similar to smallpox, but much less lethal. It can be transmitted by contact and droplet exposure via exhaled large droplets. The incubation period of monkeypox is usually 6 to 13 days, but can range from 5 to 21 days. The disease is often self-limiting, with symptoms usually resolving spontaneously within 2 to 3 weeks. Symptoms can be mild or severe, and lesions can be very itchy or painful. Milder cases of monkeypox may go unreported and represent a risk of person-to-person transmission. The animal reservoir remains unknown, although it's likely to be among the rodents. Contact with live or dead animals through hunting and consumption of wild game or bushmeat are known risk factors. Now, there are 2 clades of monkeypox virus. The West African clade, which is the one you see in Nigeria and that part of the continent, and the Congo Basin or Central African clade. And we see this in like the Dominican Republic of the Congo. Democratic Republic of the Congo. The case fatality ratio for the West African clade is around 1%, while the Congo Basin clade can be as high as 10%. And so that's what's going on. That was the big story on Friday. And I wanted to go ahead and get to that. There was quite a few things that came out of Texas yesterday. I need to go ahead and jump on all that. But you can check out more about these stories on the website outbreaknewstoday.com. And on this YouTube channel, I have videos of interviews with experts on monkeypox, stories about the Singapore case, the UK cases. So you can find all that stuff right here on this YouTube channel. Anyway, I appreciate you watching once again. Share it with your friends. Like the video. Subscribe to the channel. Comment below, and I'll see you next time.